Hello, everyone. Welcome to our forum on Canada Taiwan Collaboration Forum. And really, on behalf of the organizers, really want to welcome you joining us. Today's topic is really on how Taiwan and Canada can look at synergy in health and health domains. And it's tremendously honorable for me to be able to participate as the moderator. My name is Dr. Kendall Ho. I'm calling in from Vancouver, Canada, the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. And it is habitual for us in Canada to acknowledge our First Nations and do this land acknowledgement. And so thank you for allowing us to do that. I myself is an emergency physician in Vancouver and also a professor at University of British Columbia, Faculty of Medicine, and finally a medical director at the BC Ministry of Health on Virtual Physician. I'm really honored to have two additional panelists joining today. I would like to introduce Dr. Chun-Hui Chi. Dr. Chi is the professor of global health and professor of health management and policy and the director of Center for Global Health in Oregon State University. Dr. Chi, thank you so much for joining us. Amazing to have you here. Also, I'd like to introduce Dr. Alex Chen. Dr. Chen is an MD and PhD, and he's the Vice President of North America of Global Taiwanese Medical Alliance. Again, Dr. Chen, what a pleasure to have you here. We want to welcome you.
Thank you, Professor Hall. Thank you.
Thank you. Our format today is really using some questions and answers. So we're going to talk about three general areas of questions. And then we will be doing this dialogue and discussion, really focus on, how can Taiwan and Canada optimally synergize and work together in the area of health. And so I'm very, very excited to jump into this discussion. Perhaps maybe I'll start with the first question, and that is, what advantages are there for Taiwan and Canada to collaborate on health? What would be the thinking there, and what would be the why for this collaboration? Perhaps, Dr. Chi, I'd love to welcome you and maybe ask you to open our discussion with your thoughts on this question.
Thank you very much, Dr. Ho. Taiwan, when it started its universal healthcare system in 1920, in 1995, Taiwan learned a lot from Canada's universal healthcare. So before that, during the long period of planning, Taiwan already learned a lot from Canada. So in terms of the strengths and weaknesses or challenges, Taiwan has a lot of strengths, particularly, let me just summarize two particular. One is Taiwan has been well known for how it implement and manage its universal healthcare system, the national health insurance system. And the other one is Taiwan was able to maintain a relative high public support and satisfaction of its universal healthcare system. And since part of the origin of the planning, Taiwan learned from Canada, and so Canada might also be able to learn from Taiwan how to continue to improve the Canadian Medicare system. At the same time, Canada has a much stronger long-term care system, also a very strong health information system, as well as decentralized national health insurance. So these are the strengths that Taiwan could have learned a lot from Canada. And particularly, Taiwan is facing dramatic aging populations and with very relative weak long-term care systems. There's a lot Taiwan can learn from the Canadian long developed, well-established long-term care system. Also, Canada has a stronger telemedicine, which Taiwan barely developed during this pandemic. So for Taiwan, there's still a long way to go to learn. And I think Taiwan can learn from Canada's experience and technological advancement. Likewise, Taiwan can also learn from Canada's in terms of how to improve access. Well, Canada can learn from Taiwan highly effective healthcare cost control.
Mm.
So these are just a few examples that both country health system can learn from each other. And in our later questions, I will expand for other comments. Thank you.
Wow, wonderful. Thank you, Professor Chi. Ah, Director General Peng, can you hear us right now? I'm very glad for our audience. We have Director General Peng. He is Director General Yiming Peng is the Director General of Information Management at the Ministry of Health and Welfare in Taiwan. Director General Peng, can you hear us? Okay. We may be having some technical issues, so we'll continue to try to see if we can engage Director General Peng for his valuable comments. In the meantime, let me switch over to Dr. Chen. Dr. Chen, what are your thoughts about why Taiwan and Canada should collaborate? Dr. Chen?
Thank you, Dr. Hao. Also very much appreciate Dr. Chi's very good comments. And let me share my 2 cents regarding actually how Taiwan and Canada, both country, can have a similar common issue, but also both country has their strengths and also challenges right now both country are facing. So let me talk about strengths. So Taiwan has 2 strengths I think is very unique around the world. Number one, is Taiwan has very strong digital health technology. Taiwan, and number two is traditional medicine. So let's talk about number one, digital health technology. Taiwan has been a leader in developing digital health technology, such as electronic health records and telemedicine. So this technology can help improve the efficiency, accessibility of healthcare services. And for traditional medicine, Taiwan has a long history of using traditional medicine. And so some person may be called as herbal medicine, and which can provide alternative treatment for patients with chronic disease. And for Canada, what I've been searching about, I've been working with some Canadian doctors, and also I've been doing some research about the Canada. I think Canada has 2 strengths, I think also very obvious around the world. That number one, Canada has very strong health research. Canada is a home to many world-renowned health research institutions, such as Canadian Institute of Health Research, very famous, and this expertise can help and support joint research projects around the world, of course, between Taiwan and Canada. And also, I mean, in the past, my previous experience, I also learned from Canada has very strong indigenous health. So, of course, Canada faces a significant health disparity between indigenous and non-indigenous populations, which is a complex, challenging issue. But actually, Canada is doing very well in indigenous health. So Taiwan can learn from Canada experience in working with the indigenous community to develop cultural sensitivity, a sensitive healthcare service, and address health inequities. And also, Taiwan and Canada both face one very similar issue, that is aging population. Both countries have the same issue for aging population. So Taiwan has one of the fastest aging population in the world. I think that Canada also facing the same issue regarding the aging population, and which presents challenges for Taiwan and Canada's healthcare system. So I think both countries can deal with the aging population, as also Professor Chi mentioned, together. So can we have a research together, joint program, training, experience sharing, etc. And Taiwan has also 2 other challenges right now. Number one is a chronic disease management.
Mm.
So Taiwan, like other countries, face challenges for managing chronic diseases such as diabetes and hypertension, and also more and more is more about cancer. And so Taiwan right now has very good national health insurance, can do like early prevention and disease early detection. but still, like Canada provides a very good community-based healthcare system compared to Taiwan as a national health system. So I think both countries can share with each other that Taiwan national health insurance at country level health promotion compared to Canada is more community-based health promotion. I think both countries can actually support and can learn from each other. And but mental health, Taiwan has a very high suicide rate, and the mental health issues are often stigmatized. But I think Canada actually can share its experience in developing mental health program and services that reduce stigma and promote early intervention and treatments. And Canada, I think that what I observed that Canada is a huge country compared to Taiwan. It's a huge country. So I believe that Canada also has an issue for rural healthcare because it's a huge country with almost the same size of Taiwan's population. So Taiwan's experience on developing telemedicine and other digital health can benefit, I think, somehow the rural areas patients in Canada as well. So Taiwan can share the experience with Canada. And the last one is Canada also has a healthcare efficiency issue that Dr. Chi mentioned. I mean, this is what we heard that Canada's healthcare system is often being criticized, maybe commented by lots of Canadian regarding it's a little bit slow and not so efficient. So compared to Taiwan, has been highly recognized as a very efficient and provide high quality healthcare system, healthcare service. So I think that the Taiwan can also somehow share the experience with Canada about how to actually, with limited resource, but still can perform quick, efficient, and high quality medical care service. So these are just my sharing. Thank you.
Wonderful. Thank you very much, Dr. Chen. Professor Chin, Dr. Chen, really great points that you have made. In the meantime, Dr. Peng, if he comes back, we'll certainly want to engage him too. I think both of you are very kind about the Canadian health system. I think there's so much we can learn from Taiwan. I think number one is it's very good that both countries believe in equity of access of care. And that's why there's universal health in Taiwan. And that's why also in Canada, the system is publicly funded. I think that origins of wanting to serve our population and using a universal health system to support is a very important one. Secondly, I think it's also because disease don't recognize country borders. And in fact, from the type of diseases that we face is exactly the same as what both of you have really kindly identified. Chronic diseases that we face, the COVID infections that we faced before, and we now go from epidemic to endemic, yet still very much in many people's minds. And also, we have a good population that migrates between Taiwan and China and Canada a lot. And so I think that migration of our population, how do we better deliver care and also support our populations in that? All those makes us really in a very unique situation to want to support this collaboration. Taiwan, of course, in many international and global ranking, your system is just amazing in serving patients in great time and efficiency. In Canada, indeed, we do have issues such as overcrowding in the emergency department, long wait time for surgery, and I think there's a lot of efficiency we need to learn from Taiwan. And I think in the area of COVID and its management, again, there are some really fantastic practices in Taiwan that I think in Canada we need to learn. And in turn, in Canada, we also have looked at management of COVID, not only in urban and regional locations, but rural remote locations where we do have vast land and also many of the rural, remote, indigenous population live. And so in terms of disease management, such as infectious disease and specifically COVID, very important. And then finally, in the area of digital health, health informatics in Taiwan is just absolutely amazing. And I think we in Canada need to also learn about how do we manage the data that we have, the health patient data, and how do we across Canada look at federating the data so that it can be shared, it can be used for patient stratification, patient triage, patient management. I think all those are very important. Yes, we are very interested in research in Canada, and in digital health is no exception, looking at telemedicine, telehealth research, health services research, and also look at data science. How can we use that to capture better patient health information, stratify population, so that we can speed up and also appropriately stream patients to the right navigation of health system? I think, again, that would be a really fantastic area for us to have collaboration. I see that Director General Peng is back with us. Director General Peng, can you hear us? Director General Peng, can you hear us? There may still be some, the Director General Peng. We may be having some sound issues. So, Director General Peng, I apologize. Maybe we'll try to also fix your sound system, but
Hello,
perhaps.
can you hear me?
Oh,
I
we can
cannot
hear you
you.
now.
Sorry.
Director General Peng, finally. Wonderful. Thank you so much for joining us. For our audience, Director General Peng, as I earlier introduced, let me reintroduce again. He is Dr. Yiming Peng is the Director General of Information Management at the Ministry of Health and Welfare in Taiwan. Director General Peng, thank you so much for joining us. We were just starting our discussion about why should Canada and Taiwan work together and synergize an area of synergy in health. Maybe Director General Peng, I welcome your thoughts about why you think our two countries should work together. Oh, Director General Peng, can you hear us okay? Director General Peng? Maybe we will come back to Director General Peng. Professor Chi and Dr. Chen, if you don't mind, maybe perhaps we'll go to the next question, and
Sure.
then we'll go from there. So there's a why the two we should work together. The second question is, what specific areas do you think would be huge potential collaboration in health, would be really fruitful for us to explore? What would be the specific areas that we should think about? And with that, perhaps I'll again invite Dr. Chi, Professor Chi, to start, and then Dr. Chen. Professor Chi.
Yes, thank you. My my expertise is much less in digital health, so I will leave most of digital health to Dr. Chen. And I will comment on the first part, how both countries can collaborate in health system strengthening. So while Taiwan enjoy a very high reputation of overall management and implementation of national health insurance and high satisfaction, however, the overall quality of care, Taiwan still have a long way to improve. So the first area the two countries can collaborate will be in how we improve quality of care. Particularly earlier, Dr. Chen mentioned about chronic diseases. The management of chronic diseases, I think Taiwan has a lot can learn from Canada, as well as earlier I mentioned about long-term care. And then, given that both countries have a universal healthcare system, and both countries face the ever-growing challenge of increasing expenditure with limited revenue. So one area both countries can collaborate is how to develop a community-based, population-based governance system that in collaboration with a system of priority setting. That with a systematic mechanism and public informed priority setting, both countries can help using the limited resources while maximizing the benefit to the population, particularly in terms of the benefit, be responsive to what's the population view and value as a high priority. And another area both countries can collaborate is payment system. And
Mm.
payment system is always a challenge for any healthcare system. And both countries has been experimenting different kind of payment system. And for Taiwan's case, Taiwan is a hybrid payment system that underneath the global budget, which so far has been operating quite well, but within global budget, Taiwan also introduced the DRG system and case payment system and fee for service. And so the two countries can collaborate in how can best improve their payment system to physicians and to hospitals that both improve the efficiency of the system while maintaining both provider and patient satisfaction. And another area both countries can collaborate is the primary care. And Taiwan is relatively weak in primary care. In terms of the outpatient care, Taiwan has kind of over concentrated in the general hospitals, while weakening the community level primary care, which Canada is much stronger. And this is where Taiwan can learn from the Canadian systems. Finally, one area both countries were facing aging population and chronic disease, both countries can collaborate in developing patient advocate and patient navigation system. With a strong patient navigation system, it can greatly improve both access and quality of chronic health care. And for the digital health, I want to mention about one particular advantage that that Canada can learn. That Taiwan has digitalized the payment system as early as 2002. And so with that digitized and electronic chart and payment system, Taiwan probably has one of the world's fastest payment system that when provider uh, submitted their claim, uh, usually they can receive the payment between 15 to 30 days within that period. And so that's probably the fastest. And the speedy receipt of payment is something that both hospitals and physicians desire, and that's something Taiwan can collaborate with the Canada. Thank you.
Wow. Thank you very much, Professor Chi. Really good health system type of operations in terms of looking at quality of care, long-term care, and also the payment system to support it, also primary care support, and also the patient advocacy on the electronic portal. Those are really important areas for sure. Perhaps let me now invite Dr. Chen. Welcome your thoughts about specific areas from your vantage point would be important for collaboration. Dr. Chen?
Thank you. Thank you, Dr. Hell. So every time when I talk about two parties cooperation, I'm always looking at the party one of one of the party that strengths and also the other party's weakness. They can support each other. So on the other side, B can support A can support B. So in Taiwan and Canada's this type of collaboration, I think Taiwan has three strengths that can be shared with Canada to help address some like healthcare issues that Canada right now is facing. So three is the three items. Number one is digital healthcare technology. Number two is traditional medicine, and number three is health education. And for Canada, and Canada has strengths can support Taiwan or like work with Taiwan. Also also three I think three strengths that Canada can support Taiwan. Number one is medical research innovation. Number two is healthcare workforce development, Number 3 is mental health and chronic disease management. So let me express why Taiwan has three items or threats can actually help or work with Canada to support Canada to deal with the issues that Canada is facing. Number 1 is about digital health technology. So Taiwan has been the leader. Taiwan has been very famous for IT technology. So Taiwan's as I previously mentioned, Taiwan's electronic healthcare health records and telemedicine technology can improve efficiency, accessibility of patient to access healthcare. So Canada has been facing actually the slow and efficient healthcare system. So Taiwan technology can somehow support Canada improve the efficiency. At the same time, Canada is a huge country, so remote area and rural area patient can also benefit from the healthcare technology. And second, traditional medicine. So I think because of aging society, lots of elderly, aging population are facing chronic diseases. So Taiwan has experience to use lots of traditional medicines for years, and also Taiwan can also share experience how to integrate traditional medicine with Western medicine to treat patients with chronic disease around the world. Number 3 is health education. Taiwan has very high health literacy across all the different age groups, or maybe different ethnicity, or maybe different financial categories. So Taiwan has very good health literacy. So somehow Taiwan can also share the experience how to provide very efficient, low-cost health education to increase health literacy of the entire population. But Canada has 3 strengths, as I mentioned. Canada has very strong medical research innovation, and Canada has a strong medical research innovation ecosystem. I think that part is actually somehow can work with Taiwan and can support and guide Taiwan to share some experience with Taiwan. And Canada's advanced medical technology innovation research practice can be shared with Taiwan, and also for Taiwan to have the similar innovation ecosystem to develop certain a biomedical industry in Taiwan. Second, Canada has very good healthcare workforce development. So Canada is very famous for its well-developed healthcare workforce, like nurses, and also physicians, and also allied healthcare professionals. And so, Canada probably can also somehow work with Taiwan to develop a certain program to elevate the Taiwan's workforce capability. Number 3, mental health and chronic disease management. So as I mentioned before, Canada has very efficient and effective community-based mental health or chronic disease management program. So Canada can also share with Taiwan in a community level how to have a very efficient and also how to very effective and health promotion program in the community of Taiwan to support a patient in the community. So 3 strengths that Taiwan can collaborate with Canada, and 3 strengths that Canada can work with Taiwan. Thank you.
Wonderful, Dr. Chen. Really appreciate it. Let me check back and see if Director General Peng, I think we're still having some technical challenges. Again, we'll wait for Dr. Peng. When he joins us, I'll be reintroducing these questions to him. Really appreciate Professor Chi and Dr. Chen, your comments. Perhaps I'm going to focus mine really on the area of digital health. At the end of the day, I'm an emergency physician, and I use digital technology to really bridge the care of patients between community, where they see their family doctors, primary care, and those that need hospital acute care. And so emergency department always sits between. And so I think there are 4 areas in the emergency, or what we call primary urgent care area, that I think digital health can really help. And I would love to see research between our 2 countries to support that. Number 1 is the digital front door. I'm an old man. When I think about shopping, I would think about, okay, let me drive to this store, let me go there. But when I talk to our children, the first thing they think about is, why shouldn't we just go online and look for the things first? When it comes to healthcare, especially when it comes to urgent issues, I think many of us in Canada, and I wonder in Taiwan, we still think, oh, I have chest pain and it's gone. Should I now drive to the emergency department to be seen? Or can I wait till I talk to my family doctor? I think it'll be amazing if we have a digital front door. So, in fact, if we have such an urgent issue, that of course, if it's very severe, don't wait, take an ambulance, go to the emergency department right away. But 90% of the time, it's about something that do I need to or not go to emergency. It'll be amazing for us to have a digital front door, reliable, just in time, just for me, and just in case for our patients, so that they can actually use digital technology and support them. And so we are currently doing Canadian Health Services research in looking at on undifferentiated cases of urgency, can digital health and virtual care support our patients? In British Columbia, we work through the BC Ministry of Health. And I think in Taiwan, again, it'll be fantastic to understand how you are reaching the patients for those urgent cares. I think that's one area about digital front door of our health system. How do we introduce it? Secondly, I think data science is tremendous. Not only do we have now one patient, me, with my illnesses, but the opportunity for us is that we have 10,000 patients with diabetes, 100,000 patients of heart attack, 500,000 patients of hypertension. And so how do we leverage this data? So not only for today, we can use and help our patients in front of us, but leverage data science so that we can understand this population, use the knowledge that we capture to say, tomorrow, how do we stratify these patients better? For example, we've done a study about patients with high blood pressure. We know that for patients with high variability of high blood pressure, the high number and the low numbers varies a lot, as opposed to low variability. The high number and low number stays relatively the same. That population of higher variability has higher risk of stroke and higher risk of cardiovascular diseases as a sequelae. And so using data science for us to stratify the population so that we know that for those patients we need to do intervention would be amazing. Coming back to digital front door, if we can understand for the patients who come into our front door and use data science to decide if I have this medical record and with this presentation of illnesses and with this set of vital signs and physiologic measurements, then these patients need much faster stratification to see emergency doctor with. For others, not as much. It really helps us in planning the health services and health resources that we can. So again, data science allow us to look at population health, look at management of illnesses as we move forward, and also look at health system effectiveness. Back to Professor Chi's discussion about having a more cost-effective health system to serve all of us. And finally, of course, if, for example, I have my own data, knowing when am I sick, when am I well, and in fact, if the data science that gives me my own data, so that when I turn on my mobile phone every morning and I said, well, today you have good oxygen saturation, your heart rate's very good, your weight is under very, very good control, you can do 30 minutes of exercise. This is a good day for doing that. Giving myself a bit of a health weather report, if you will, so that I can do better self-management. Again, data science can do that. And so all this implies that we need to have good technologies, not only for the virtual care, good technology to capture the data science, but good technologies also, the third area, is to capture our own physiologic phenotypes. What is my blood pressure? What is my heart rate? Am I walking straight today? Am I seeing well? Am I hearing well? And also, is my mind in good cognitive arrangements? These are things like natural language processing. While every time I speak, every time I type, my logic get captured, my choice of words get captured, my mood get captured in my words, and also my facial expression and my voice. And all of this gives me a sense about what I'm like today. Imagine if we have these technologies to capture the physiologic state of ourselves married with our electronic record and married with population health, that really advanced today's care very, very much. And perhaps one final area I would like to discuss is that digital health shouldn't be done by itself. In fact, it should be a hybrid care. How do we connect digital health using technology and in-person health? We all accept that digital health can only get us so far. But if we can couple the two together to become hybrid care, it's amazing. All of us do banking. There are days that we'd say, geez, I don't want to go into the bank and deposit my check. And so we go online and do the depositing. But there are times also we say, well, this issue is too complicated. I don't want to just go through computer. I don't just want to go through my mobile phone. I want to get into the branch, see the manager face to face, and discuss about this issue over time, in-person banking. So we should do exactly the same for healthcare. That, in fact, we need to combine digital with in-person to create ideal hybrid care. I think those are the four areas I think that will be really exciting on digital health that we can collaborate together. Maybe I'll step back now and again like to check where the Director General Peng. Can you now hear us, Director General Peng? Director General Peng, can you still hear us? Yeah, perhaps we're still having some technical difficulty there. We hope, I do see that we are, Director General Peng has someone helping him. So I really hope that before the end of this session, we will be able to get his invaluable comments. Let me move on to the third area. In fact, Dr. Chen has already touched on it, and maybe I'll ask Dr. Chen to actually start this one. And that is, how can we really support the, Director General Peng, can you hear us? Director General Peng, can you hear us? Okay. Why don't we come back to Director General Peng? Dr. Chen, you already alluded to the fact that this is about health human resource planning and education. How can we use the opportunity for the two country collaboration in supporting capacity building and health human resources building through this collaboration? Maybe could you go into a little bit more detail, Dr. Chen? Love to hear your thoughts about health human resource and also the training area. Dr. Chen?
Thank you, Dr. Ho. So I really like the points you mentioned about digital tools. I have lots of ideas. I really want to make it happen, no matter in which country. But there are lots of legal issue, privacy issue, funding issue, and also lots of technology issue. But if we all the country can work together, I think once we have the tool, we can use it. We can give the tool to the patient around the world. So regarding the topic you mentioned, like Taiwan and Canada, I think both sides, I will talk about two aspects. One aspect is more about human resource. The second aspect is about digital tool usage. So for human resource in the healthcare system, I think Taiwan and Canada can work together in 2 points. First point is exchange program. So Taiwan and Canada can establish exchange program that allow healthcare professionals, researchers, and students to visit and learn from each other's healthcare system, and also to know that if there are any tools that can solve the common issue for both countries. And also at the same time, both as healthcare professional or researchers or students, they can help enhance their knowledge and skills and cultural understanding to promote international collaboration between two countries. Second is joint research projects. So as you mentioned, Dr. Ho, you mentioned, Dr. Ji mentioned about two countries joint research project. So I think the digital project will be a very good one that once we have a digital tool and we can have some clinical trial in Taiwan or Canada. So in Taiwan, Canada can collaborate on research, lots of research projects, not just for digital tool, but also probably for medical education and also for health policy and healthcare management or maybe clinical practice guidance. So this project can help build research capacity and generate new knowledge idea cross-country, cross-culture, and cross-ethnicity to promote evidence-based practice in both countries. Regarding the digital tool usage, So I think there are 4 points that Taiwan and Canada can work together to elevate the healthcare quality. Number one is to training and mentorship program. So regarding the digital tool, very important part is if we have very good digital tool, so how we're going to train our healthcare professionals, also our patient to use the tool. If no one use the tool, we won't be able to collect data. We won't be able to actually to really to leverage the power of the tool. So Canada and Taiwan can develop training and mentorship program for healthcare professionals and also for patients if possible. And this program can provide hands-on training, coaching, mentorship to improve the quality and effectiveness of digital health service. Number two is capacity of building grants and scholarship. So usually we need have some certain grants, provide certain grants. Maybe both countries provide certain grant for both countries' healthcare professionals or researchers to develop digital health service. Number three is collaborative projects. As I mentioned before, like if Taiwan and Canada, both countries can collaborate joint project to develop and implement digital health tools, and that can benefit both countries at the same time. And also, we can also both countries can also develop a telemedicine, electronic health records, or maybe mobile health apps by using two different languages, by under two different populations, and also different disease and distributions. I think by having two pretty diverse and different diverse background countries to run or test one tool can really benefit the tool and really develop a tool for greater use in the future. And standard and interoperability. So Taiwan and Canada can work together to develop common standards and interoperability framework for digital health tool. So as I mentioned before, so digital health sometimes is more about legal issue, privacy issue, regulation issue, etc. So both countries can have certain platform to how to actually support or encourage digital tool in the market. At the same time, can also discuss that how we can actually, remove those obstacles for our great digital tools to be introduced to the market. At the same time, we can also learn from each other and how can we protect patients' privacies, patients' rights, and patients that are self-willing to make some decisions whether they want to take a treatment or not. So if Taiwan and Canada can work in training, capacity, collaborations, and also legal or like a standard and interoperability, I think they can be very beneficial for both countries.
Wow. Excellent comments, Dr. Chen. Really appreciate that a lot. Professor Chi, I also welcome your comments. Thinking about health human resource and training and capacity building, what are your thoughts, Professor Chi? How can we collaborate?
Yeah, thank you very much, Dr. Ho. Also, thank you for Dr. Chen's very, very detailed, excellent plan about the digital health planning. And as I mentioned, I have little expertise in digital health, so I will comment more on the health system collaborations. And Dr. Chen already mentioned about the importance and benefit of collaboration in research and including exchange of researchers to collaborate in project and this to solve the common issues. In addition, I would suggest the collaboration of both Canada and Taiwan in primary care level. Earlier I mentioned, Canada has a much stronger primary
另外
care
一
that
样的问
Taiwan
题
can
啊，
learn from. And so the two
不是我
countries
听的
can
问题，
collaborate in how we both improve the efficiency of primary care level, but also how we build the more accessible primary care and also with the patient support systems, particularly in managing chronic care. And in terms of digital health, one area in the near future will become more prominent is the role of artificial intelligence coupled with big data. And the combination of the power from this tool can greatly enhance both access but also quality of our healthcare, while simultaneously potentially reduce the cost of healthcare. However, with the digital health, I do want to provide one cautionary note. From our experience during the past 3 years of the pandemic, which at least for the first 2 years, many part of our activity, particularly education, will resort to remote online. And based on many evaluation, we now learn that highly dependence on mobile internet has widened the gap the well to do and to
Uh, Professor Chi, you seem to be cutting in and out. Dr. Chen, can you hear me still?
Oh, I can hear you perfectly. So Dr. Chi,
Yeah.
I couldn't hear him as well. So I think it's
Uh,
more like a connection issue.
mm. Maybe I will see if I can come back to Dr. Professor Chi. Director General Peng, can you hear us at this time? Director General Peng. Uh, we're still experiencing audio issues. We do see Director General Peng, very much so, and we know that he wants to join us. So really want to appreciate Director General Peng being here. But unfortunately, I don't think we're hearing him, nor is he hearing us, I think. Yeah, unfortunately. So maybe while we're also waiting for Professor Chi to come back, maybe I'll make a few comments. Really love what Professor Chi talked about in terms of health system. How do we try to understand that area? And of course, Dr. Chen, really appreciate your several areas, including health professional education, research program, grant funding to increase it, to also support patients to understand that. And so really appreciate that. Professor Chi, are you back? Can you hear us now? Professor Chi. Professor Chi, can you hear us? And Director General Peng, can you hear us? We seem to have two audio issues here. Again, just like technology, it does happen this way. And good thing we're not doing neurosurgery with this technology today, so that we
That's
have
true.
to halt the surgery. On the other hand, I think the dialogue is actually going very, very well. Professor Chi, I'm going to try one more time and see if you hear us. Professor Chi. Ah, okay. So maybe I'll make my comments to add on to Dr. Chen and Professor Chi's comment. I think in health professional education in Canada, I'm involved with the Royal College of Physicians Surgeons of Canada and also in our university in health professional education. Absolutely, we need to. The question is, how do we integrate this into the curriculum? It is not about doctors learning to use computers. It is about understanding the principles of digital health and virtual care and the use of data so that we can do our healthcare services better. This is where the really focus of the training needs to be. It's not about teaching doctors know how to fix computers, far from it, but knowing how to use the data to better manage diseases such as chronic diseases, aging population, and primary care. That's the type of education that we need to really focus on. And I also support Dr. Chen's discussion about supporting patients. There's a car company who had a campaign. It's called Drivers Wanted. And it was a good campaign because they talk about the fact that I could build the best car in the world. But if nobody knows how to drive it, that car will just be sitting on the curb and nobody knows how to use it. We're designing a lot of digital health technology, big data, data science, virtual care, but we need to support the digital health literacy of our patients so that they know how to use it, so that when they go into their patient portal, that they can extract the type of information that's necessary for self-care, optimizing self-care. Perhaps one area that I would like to highlight, and it crosses both Dr. Chen and Professor Chi, is how do we support our policymakers to generate evidence-informed policymaking in digital health? It's great that our health policymakers are doing funding decisions, looking at health system design, but how can we as researchers, clinicians, academics, patients, bring the right type of evidence so that our policymaker can make the right type of policy to say, I will invest this funding into the digital health infrastructure, to data interoperability, to a common national infrastructure, to a sharing of data and privacy legislations so that we can enable digital health to happen. I think that area of evidence-informed policy translation in digital health is very important also in the health human resource and capacity building for our communities. And so at the end of the day, I think the research, the health professional education, the patient education, and also the health policies is very important. In Canada, in next week, we're going to have a national conference in looking at the issue of essential digital health for the underserved. Each of those have important elements. Who are the populations that currently our health system are not serving well enough? And how can we increase the health services and use digital health as an opportunity to elevate that service? What is essential digital health? One can argue that cosmetic surgery in a community for appearance may not be essential, but appendectomy would be essential surgery for a community. And so, in the same way, what is essential digital health for all the communities so that we can achieve equity of care? I think that's going to be a very important question, not only for the policymakers, but for the health professionals, patients, and health administrator joining together for that kind of discussion. I think that type of discourse and discussion will be so important for us to build health human resource and capacity. Let me now check Professor Chi. Can you still hear us at this point, Professor Chi? Now, let me also check Dr. Chen. Can you hear me right now?
I can hear you perfectly. So,
okay, thank you.
So that only both of us can discuss within this forum. So I think regarding actually you mentioned about the essential digital tool. So my suggestion is that I think number one, we need to identify what are the pain points for each country. There are several diseases we want to tackle, right? But we won't be able to solve all the problems at the same time. So I think number one, we need to know that which disease we want to target, especially for those common disease that we can quickly use digital tool to really change something. That's first step. And number two is once the patient have been well accepted and will accept this digital tool, and then we can expand the tool to more disease. Number three is we can look at those like a disease that really related to behavior changes, because some of the disease is really depends on the treatment, depends on surgical techniques, depends on a capacity of the hospital, depends on actually the medications. But some of the diseases that is really highly related to patients' behavior. So this is something that I think somehow that digital tool can play in that area from the very beginning, because we know digital tool is most of the is interactive with patients, and somehow they can provide certain like a warning or a reminder for patients, and also to change the patient's behavior day by day. So I think we can take on these four directions, and as a pilot for both countries or for many countries around the world who are interested in digital tool to improve patient healthcare quality. That's just my suggestion. And also, I really like that the you mentioned about to put the digital curriculum into the medical physician, medical doc students actually education. I think it's a very good idea, because right now we couldn't actually stop using digital tool. Even a younger generation doctors started to use that what if we can have better choice, better suggestion for patient to improve the quality of care? If there's a tool over there, I would like to use that to confirm that maybe my suggestion is more appropriate for the patients or not. So of course, it's like assistance for doctor, but still a very good guidance for doctor to double confirm that the physicians are making the right choice.
Yeah. Wow, Dr. Chen, those are really excellent points. Really appreciate that. And also, trying to identify, I think on a global front, there's lots that we can do together. But what would be the starting point for us to get on ramp and get going on that collaboration and the capacity would be very, very important. Let me come back now to check if Professor Chi or Director General Peng, whether they can still hear us or whether we're still having technical difficulties on that. Maybe I'll start with Professor Chi. Can you hear us okay at this point? Yeah, we're still having some difficulty with Professor Chi. It looks also like Director General Peng has gone off screen. So I think maybe perhaps I will invite Dr. Chen as we now Professor Chi, can you hear us? I just see your image coming back at this particular time. Yeah, unfortunately, we are time flies. Really a fantastic dialogue, and we're down to our last 3 minutes. So maybe I will turn to Dr. Chen. I welcome you. If you have any concluding thoughts, maybe I'll invite you to speak a little bit about how you feel and what are some of the perhaps wisdom that you can leave with the audience here.
So, so for me, is I really want to see that both countries are facing different health issues in each country. At the same time, both countries has a strength in the healthcare fields. So I really want to see the collaboration of strengths and also the challenges for both countries can work together and closely, and also to elevate the quality of care and also to bring more benefits for the patients around the world. And Canada and Taiwan collaboration just starts. Eventually the collaboration, the benefits of collaboration will also expand to more countries around the world. And I think that is what Taiwan and Canada, both democratic countries, want to see a healthier world.
Excellent. Thank you, Dr. Chen. Let me finally check again to see if Professor Chi, can you hear us, Professor Chi? And Director General Peng, I think he is now offline. And Director General Peng, can you hear us? Yeah, if not, maybe I'll proceed with my concluding remarks. Again, Dr. Chen, really appreciate what you just said. I think we share the ethos of equity of access of care because of the universal health system. And because of that, I think there's huge opportunity for us to join together. I think we also share the pathos, the passion that we really want to deliver the best of care for our citizens and to use the best medical system, the best policies, the best medical treatments, and the best digital health to support our patients. I think that passion is vitally important. I think it is then the logos, the logic of how do we want to make sure that we can have good, strong collaboration in not only the delivery of services to really create the best practices, but also to understand how do we do research to continue to improve what we do. And at the same time, build capacity so that our health professionals, our patients would know how to navigate our health system and use the different tools appropriately, and then with our governments setting really fantastic good policy to support the delivery of care. I believe those are the very essence of elements that would really fuel the collaboration for what we can do together and really propagate this. And so with that, I'm going to conclude. And this is the Canada Indo-Pacific Strategy session. And I really want to welcome and thank all the audience so that we can continue our multifaceted engagement together, which will include in collaboration in trade, technology, health, democratic governance, and countering disinformation. And for this session, we really had a great exploration on health. And so with that, our times is up. I really want to thank Dr. Chen. I want to thank Professor Chi. And despite the fact that we have technological issues, I want to thank Director General Peng for really spending the time together for this time. And so with that, thank you very much, everyone. Take care, and I look forward to future sessions where we can actually discuss what we have done and continue to do together. Take care, everyone. Have a good day or evening wherever you are. Bye-bye.
Thank you.
No government has the right to take away. It sets out our right to freedom and equality and justice.
How many times do I have to teach you? Just because something works doesn't mean that it cannot be improved.
Taiwan International Healthcare Training Center integrates the health capability in Taiwan and keeps providing continuing education trainings for healthcare professionals. In the past 20 years, TIHTC has successfully trained over 2,000 international healthcare professionals from 77 countries.
We will save more Ukrainian children's lives with the sincere support of the people of Taiwan. All of our colleagues, we want to thank Taiwan for this help.
Since the 1950s, Taiwan has been providing various medical aid and technical services to African countries. During the COVID-19 pandemic, Taiwan assisted its diplomatic ally in helping pregnant women maintain maternal and child health. Early neonatal mortality rates have seen a decline of 1%. In the hospitals joining the program, the number of deaths of newborns dropped from 234 to 189 in 2022.
Nationwide affordable and accessible healthcare is a reality in Taiwan, with 99.9% of the population enrolled in the health insurance system. In an effort to promote fairness and human rights, foreign nationals have also been included in the healthcare system. According to the global database website Numbeo, Taiwan has topped the list of the healthcare index for 4 consecutive years as of 2022.
Taiwan continues to be an indispensable partner on the path to global post-pandemic recovery.
Well, there are countries like Taiwan who were exemplary, saw the problem, and
we believe that Taiwan's role as an observer in World Health Assembly meetings is in the best interest of the international health community and also is an important partner in the fight.